Dear friends, Namaskar. I am Dr. Anil Taneja. Today I will talk on how can we record our blood pressure at home very accurately. To record blood pressure at home, we need to have a portable digital blood pressure monitor. Many types of BP monitors are available in the market. In my practice, I use Rosmax or Omron. I have found very good results. Other types of blood pressure measuring machines like mercury sphygmomanometer or NRAD dial type BP monitor, they are also used. In their case, the only difficulty is that stethoscope has to be used, which for a non-medical man will be little difficult. So it is always preferred to have a portable digital BP monitor rather than having those. In these monitors, we have a machine and a cuff with tubing. The other end of the tube is connected to the machine. To have an accurate reading, we need to have a proper size of the cuff for our body type. The cuffs are usually of three types. One is a large one, which is specially made for those persons who are very obese. Then is a medium size cuff. They are for the average built persons who are neither they are thin nor they are obese. Then the third type is the small type, which is exclusively made for kids or for those who are having thin arms, who are very lean persons. When we have consumed tea, coffee, smoking, alcohol, or we had some heavy exercise, or we had a good aerobic game, or we had some quarrel with some person, or we are not in a good mood, we are angry, it is better to wait for half to 1 hour before recording blood pressure. The blood pressure can be recorded either in the sitting posture or in the lying position. Any of the arm can be used to record the blood pressure. To record blood pressure, sit on a chair with back support. Sit in a relaxed posture. Sit with both the feet on the ground. Legs should not be crossed. To relax your body and mind, it is best to just close your eyes and for 2 to 3 minutes just observe your breath coming in and going out. Just for 2 to 3 minutes. Once you are relaxed, then you can record your blood pressure. Keep your arm resting on a table, hands open, palm facing towards sky. Then apply the cuff. While applying the cuff, you must take few precautions. Just ensure that there is no residual air left in the cuff of the previous recording. If it is there, just squeeze the cuff, it will be out. Normally it is deflated by itself, but sometimes some air is left, which gives false readings. The cuff should be preferably applied on the bare upper arm. Just see that the tubing is on the front side and the joint of the cuff with the tube should be slightly on the inner side of the arm. The lower end of the cuff should end about an inch above the elbow joint. The cuff should neither be too loose or too tight. It should just be about a finger loose. Once the cuff is tied, switch on the machine and sit quietly. Don't talk, don't move, at least don't move the arm on which the cuff has been applied. Sit relaxed. Don't try to look at the screen of the monitor. Just either close your eyes or you can see around. You may hear the sound of the motor as it inflates the cuff. There may be some feeling of tightness on the arm. Then it is deflated. Then you can see the readings on the screen of the monitor. There are usually 3 readings. One is systolic blood pressure, upper blood pressure, then is diastolic or the lower blood pressure, and then is a pulse rate or the heart rate. Here is a demonstration how to check BP. Here the blood pressure is being recorded on a dining table. First we squeeze the cuff to release any leftover air, then we tie the cuff. First we make the arm bare and then we tie the cuff. When we tie the cuff, we must ensure that the tube is on the front side and the connection of the tube to the cuff is slightly on the inner side of the arm. The lower end of the cuff should be somewhere 1 inch above the elbow. The cuff should be 1 finger loose. Then we connect the tube to the machine and then we relax. We can relax just by closing the eyes and watching our breath, or we may just breathe little deep, or anyway we need to relax. Then we switch on the machine. Once the machine is on, you can feel some motor is buzzing. There may be some tightness in the arm. You are not to see the screen of the machine. You are not to move. You are not to speak. When that cuff is deflated, there is no pressure in your arm, then you will see that the reading of the blood pressure appears on the screen and you can watch it. These machines are extra sensitive. Even a mild disturbance can cause a false reading. So it is always better to take 2 to 3 readings and then calculate the average. False high readings are more common than false low readings. Here are few common errors which can give wrong readings. When arm is not positioned properly, when height of the table is not proper, when machine is not at the level of the heart, when there is improper size of the cuff, when there is some residual air left in the cuff, when the cuff is too tightly or too loosely tied, when the cuff is placed high in the arm or is low on the elbow, when the tubing of the cuff is somewhat kinked. So if these errors are taken care of, we can have the accurate blood pressure reading. I hope you will find this talk helpful to record your blood pressure accurately. If you have any questions, any suggestions, or you want to share your personal experience, you can always write in the comment box or at the given email ID. If you find the content useful, you can like or share the video. And if you want to receive more such like videos, you can always subscribe the channel. May God bless everybody. Thank you.